Let's talk about a common trap, using the bathroom scale as the only measure of health after 60. The scale can tell you your body mass. It cannot tell you how much of that mass is muscle, fat, or fluid. And after 60, that difference matters. What many people miss is sarcopenia, age-related loss of muscle strength and muscle mass. Modern consensus groups emphasize that low muscle strength is often the first clinical signal. This matters because sarcopenia is linked, across many studies, to higher risks of disability, falls, hospitalization, and earlier death. Even people with a normal BMI can have low muscle and higher metabolic risk. So instead of obsessing over one number, focus on 3 practical categories. First, strength and function. Pause. Second, waist size and shape. Pause. Third, healthy routines that protect muscle. Let's make this practical. Simple function checks you can discuss with your clinician. A. Chair stand test. Use a stable chair against a wall. Cross arms only if safe. Stand up and sit down 5 times. If it takes longer than about 15 seconds, or you feel dizzy or unsteady, that's a reason to ask for a strength and balance assessment. B. Grip strength. A handshake is not a measurement. A simple dynamometer test in clinic can quantify grip strength and help screen for probable sarcopenia. A better shape check than BMI is waist to height ratio. A simple public health message is to keep your waist circumference below half of your height. This does not diagnose disease, but it can flag central fat that is linked to cardiometabolic risk. The physiology without hype. After a meal, glucose rises. Skeletal muscle is a major site where glucose can be stored as glycogen and used for energy. Exercise training increases muscle's capacity to take up glucose. But please note, physiology is not destiny. Muscle helps metabolic health, but it does not erase all risk. Blood pressure, lipids, sleep, medications, and medical conditions still matter. Now the action plan, evidence-aligned and senior-safe. Action 1. Strength training. Progressive, safe, and consistent. Older adults benefit from muscle strengthening activities at least 2 days per week, and many also need balance-focused training to reduce falls. Start with what you can do safely. Technique first. Progress gradually. Avoid breath holding and stop with chest pain, severe shortness of breath, or dizziness. Action 2. Protein. Enough and individualized. Many older adults need higher protein intake than younger adults, but the right amount depends on body size, appetite, kidney function, and illness. A common approach is spreading protein across meals and choosing high-quality sources. If you have chronic kidney disease or complex health conditions, discuss targets with your clinician or dietitian before increasing protein. Action 3. A short walk after meals, if safe for you. Light walking after eating can lower post-meal glucose in many people. If you are unsteady, use support, walk indoors, or start with very short bouts. Safety beats intensity. Action 4. Reduce long sitting. If you sit for long periods, break it up. Standing or short light walks can improve post-meal glucose control in research studies. Set a gentle reminder and move regularly. Action 5. Sleep. Support recovery and function. Deep sleep is linked to natural hormone rhythms, including growth hormone secretion. But the key message is simpler. Better sleep supports energy, balance, mood, and recovery. Use basic sleep hygiene, consistent schedule, a cooler or darker room, and fewer screens before bed. A careful note about supplements. Some supplements, like creatine monohydrate, are being studied for strength benefits, especially alongside resistance training. But safe for everyone is not accurate. If you have kidney disease, take multiple medications, or have frequent dehydration, talk to your clinician before adding supplements. And for cognition, the evidence is still evolving. Now, motivation without the scale drama. If your weight goes up while you get stronger, that is not automatically bad. What matters is whether you are improving function, standing up easier, walking steadier, carrying groceries, climbing stairs, and staying independent. And one more critical point. Unintentional weight loss after 60 is not a victory. It can be a warning sign. If your weight drops without trying, tell your clinician. So here's your takeaway. Don't worship the scale. Use it appropriately. Prioritize strength, balance, waist size, and daily movement. Eat enough protein for your situation. Sleep well. And when in doubt, especially with multiple conditions, ask for a tailored plan.